This is Kathy Knipfer, instructor for Nursing 2313, recording the Community-Based Nursing Lecture for Chapter 1, Overview of Community-Based Nursing. There are certain trends that we should watch when we think about the future of nursing. There are the changing demographics and increasing diversity, the explosion of technology, the globalization of the world's economy and society, and consumers are more educated. They use alternative therapies more frequently. Also, the advances in the study of genomics and the increase in the use of palliative care. Other trends would be the shift to population-based care and the increasing complexity of care, the cost of health care and challenges of managing that care. There's also an impact of health policy and regulation, and there's a growing need for interdisciplinary education for collaborative practice. We also should be well aware of the current nursing shortage, opportunities for lifelong learning, and workforce development. There are also significant advances in nursing science and research, and we should be tuned into that. There has been a shift over the years from community care to hospital care and then back to community care. In 1910, 90% of nursing care was provided in the home, but after World War I, care began to shift back to hospitals. Hospitals were used more frequently for healthcare delivery because of the increasing complexity of the technology in healthcare. Then in the early 1980s, cost containment efforts resulted in a return back to the community to provide care. There are distinct differences between the hospital and home environment. In the hospital, resources are predetermined, and in the home, those resources are variable. The hospital environment is predictable, while the home environment is highly variable. We can locate clients easily in the hospital, but in the home it requires planning. Access to clients is guaranteed in the hospital, but it isn't in the home. The focus in the hospital is on the individual client, but in the home we look at the client in the family system. Family support is helpful in the hospital to accomplish client outcomes. Family support is critical to accomplish outcomes in the home. The client role is relatively dependent in the hospital, but is highly autonomous in the home. For safety, in the hospital, it's under the auspices of the agency. In the home, it's very unpredictable. There may be threats in the environment that compromise safety. Healthcare funding. As you know, healthcare is expensive, and the costs continue to increase. Most individuals and families will not be able to afford to pay for care out of pocket. Private and governmental programs provide coverage for healthcare costs. Examples would be group insurance, Medicare, and Medicaid. Many of these programs have restrictions, and this results in the individuals being underinsured. The Affordability Care Act was passed in 2010. It was passed as an effort to begin major healthcare reform, and it was designed to provide coverage to the 32 million uninsured. Some provisions were implemented immediately, while others were implemented later. The registered nurse should understand the critical shift in healthcare delivery that would result from the passage of this Affordability Care Act. We frequently hear about the impact of the nursing shortage on healthcare. The need for registered nurses continues to increase while the number of those graduating from schools of nursing is declining. There is a shortage of nurses prepared at the BSN and graduate levels. This results in fewer nurses being available to work in the community. The shortage is perpetuated by the shortage of nurse educators. These educators prepare the next generation of nurses. It's estimated that there will be 1 million nurses short of need by 2020. The nursing shortage will create a permanent shift in the labor market. This shift is unlikely to reverse in the next few years because the average age of the population is increasing along with the average age of the registered nurse. So action is needed to put in place strategies that help to meet the market demand for a stronger nursing force. Let's define what a community is. In general, Jostin describes a community as a people, location, and social system. The people would involve or would include individuals, families, and cultural groups. The location could be geographic, political, or diffuse. The social system could be economic, educational, religious, political, recreational, legal, healthcare system, safety and transportation system, as well as communication systems. There's a chart in your book on the characteristics of a healthy community as well as an unhealthy community. The healthy community has safe transportation, schools, and neighborhoods. It has clean air and environment. It has well equipped parks, open spaces, and organized recreation. There is high quality mixed income housing. The groceries are well stocked with nutritious food offerings. And the streets are clean and easy to navigate. Healthy communities also have well kept homes. They have organized multicultural community programs, social services, neighborhood councils, and other opportunities for participation in community life. They have available and accessible primary health care. So let's discuss the difference between community nursing and community based nursing. Community nursing also may be referred to as public health nursing. These nurses have a responsibility to the population as a whole. With both areas, with community nursing and community based nursing, it's a philosophy of practice. It's how the nurse practices, not where the nurse practices. The focus in community nursing is on promoting the public's health. With community based nursing, the nurse provides care to individuals and families across a continuum, focusing on health promotion and rehabilitative primary health care. It is designed to meet the needs of people as they move between and among healthcare settings. Community health nursing is a subset of community based nursing. The National League for Nursing describes components of community based care. They are self care, where the client and family have responsibility, preventive health care, care within the context of the community, continuity of care, and collaborative care. Competencies for the nurses working in community settings require knowledge and skills in assessment, program planning, communication, cultural competency, dimensions of communities, public health science, as well as management and leadership. Who believed that the nurse working in the community must treat social and economic problems and not just take care of sick people? A. Mary Brewster, B. William Rathbone, C. Lillian Wald, and D. Florence Nightingale. The answer is C. Lillian Wald. The rationale is that Lillian Wald, who is the founder of public health nursing, drew on contemporary ideas that linked nursing, motherhood, social welfare, and the public. She understood that nurses could reach and educate their clients in the broadest sense by drawing on diversity of cultural beliefs and societal demands of the populace. And question number 2, how is community defined? A. People, B. Location, C. Social system, or D. All of the above? The answer is D. All of the above. And this is based on Jostin's definition that we discussed earlier. Question number 3, which of the following are characteristics of a healthy community? A. Magnet hospitals with premier surgical procedures available. B. Quality rehabilitation services for tertiary care. C. Quickest first responder service in the region. And D. A safe environment. The answer is D. A safe environment. And we reviewed all those characteristics of healthy communities previously.